Uh, Hi, welcome you all. Very good morning to all of you. I am Dr. Saurabh Ranjan, and I belong to the land of Ashoka, that is Patliputra, is Patna, and my ancestral place is Katihar in Bihar. I have completed my MBBS from Katihar Medical College in Bihar. It's a very beautiful medical college in the Simanchal area of my state, Bihar. And after that, I went on to complete my post graduation in general surgery from Raipur in Chhattisgarh state, the erstwhile Madhya Pradesh. And post that, I joined as a neurosurgery postdoctoral super specialty training in Kovai Medical Center, Coimbatore, Tamil Nadu. So right now I am practicing a general surgeon who is specializing in neurosurgery as a super specialty, and I will take this opportunity and utilize the social media to create awareness around topics which are very close to my heart, in the field of neurosurgery, the brain, and the spine surgery, to be precise. My interest in the future will be dealing with the trauma to the brain, the spine, as well as various different kinds of surgeries, the microsurgeries concerning the brain and the spine. In that direction, I want to create awareness within the population of my state and my country, so as to make them aware of what is going on in the field of neurosurgery today, and how we can create awareness around various topics regarding neurosurgery, so that our population feels at ease when they come to a neurosurgeon, or even they know at least something about neurosurgery and what to expect when they visit a neurosurgeon, or even they have some idea when they come in contact with with a case or a patient of brain trauma, the spine trauma, or even the lower backache patients. So this is an endeavor on my part to create awareness in the field of neurosurgery. Okay, so the first topic that I've chosen to talk with you all is on the epidemiology of the traumatic brain injury. As you would know, traumatic brain injury is a very debated topic across the world, because we suffer from traumatic brain injuries in case of road traffic accidents, or when somebody falls off from a roof or falls off from the stairs. So therefore, traumatic brain injuries are a very difficult situation for the family as well as the healthcare provider, where we want to understand the causes behind trauma, how we can prevent the trauma actually, because the cost and the management part of the managing of the head injuries and the traumatic brain injuries are very costly. So we'll talk about traumatic brain injuries today, and I would like to take you through the fact that since I joined neurosurgery this year, I've been feeling it very close to my heart, and the topics, the surgery that I do with my faculties, it is very heartwarming, because the kind of impact we create, the kind of the casualties we see, and still when I see patients walking after 1 month or 1.5 months of our surgeries, patient going back to work, patient going back to economically being productive, that's what excites me to this branch, and makes me aware that we can have an impactful intervention in our field of neurosurgery. So first of all, I would like to tell you that I'll be creating awareness socially, and I'll be using the Bible of neurosurgery, which we as residents of super specialty neurosurgery day in and day out study. This book will be the reference standard for my talks. Will be this book of neurological surgery. It is written by Humans and Win Neurological Surgery. It is a book which is for the neurosurgeons world over. It is actually considered Bible of neurosurgery for all the neurosurgeons across the world. I would like you to understand and know that neurosurgery practice demands us to go through this Yeoman's book, which is 1, 2, 3, 4, 5, 6, 7, 8, and this 9th. All these books are the neurosurgery Humans and Win neurosurgical book, which is divided into 9 volumes, which we have to completely go through within 3 years of our neurosurgical super specialty training. So today, as we speak, we'll take the topic of epidemiology of traumatic brain injury. The interest in traumatic brain injury is very precise because India being a country of 140 crores and having development going across the board, the new incidents of road traffic accidents, pedestrian traffic injuries do occur daily. So it leads to a big burden on the family who goes on to have this head injury, and a big burden for the healthcare provider also, and also for the organization they are working. So all in all, the traumatic brain injuries are a big topic of discussion in our medical profession. So I'd like to bring your attention to the fact that it's a big socio-economic problem for the world, no doubt about it. And it is also considered as a silent epidemic. Silent because nobody talks about it till when it has happened to you or your kith and kin. So it's a silent epidemic. We talk about diabetes, we talk about hypertension, we talk about cancers, but we never talk about road traffic accidents and traumatic brain injuries. So this is considered as a silent epidemic in that sense of the term. Now going to the fact that traumatic brain injuries can be sustained from one road traffic accident to the violence or the physical assault, 3 sports injuries or the activities of daily living. Sometimes somebody can fall off the stairs, rooftops, and all those things. So RTA can so traumatic brain injury can occur. Most important cause of traumatic brain injuries are mostly road traffic accidents or motor vehicle accidents in developing countries like India, and traumatic brain injuries can also occur in persons who have had an elderly who experience sometimes fall from a bed while sleeping, or fall in the bathroom while acts of urination, or long standing or postural hypotension. All those cases there are inadvertent head injuries requiring neurosurgical intervention. So therefore the point of discussion regarding and creating awareness about this topic was epidemiologically we have to understand what are the causes of head injury, and we have to understand that such are the causes of head injuries across the world, and we should be aware so as to prevent a future head injury to our kith and kin. Only when we know that these are the causes that we get aware how to prevent it. Okay, so the global burden, the global perspective of the traumatic brain injury, the global burden according to the Humans and Win, it has been said that the global burden of head injury is and traumatic brain injury is, they have a data which they are saying that almost half of the world population across their lifetime are expected to have some kind of a head injury. So in the child can fall off the stairs, a child can fall off from a rooftop rooftop without a boundary. Sometimes a child can fall off from a bicycle, sometimes a young man can fall off from stairs, sometimes we can fall off from bikes, or we can have accidents from motorbike, motor cars, or even sports injuries we can have on the head by falling while playing high velocity sports like skiing, like even hockey or football. So we should be aware that what sports, what activities we are going in. So there could be head injuries, so that we take care before going in for that kind of activity. Now, how do we classify traumatic brain injuries? It's very important for the public to understand and make themselves aware that when there is a head injury and they will reach a neurosurgeon or an emergency department, the neurosurgeon will find out the severity of the head injury. Now, for that severity of the head injury, and to assess the global consciousness or the deterioration of consciousness basically in those patients, we'll have to do a Glasgow Coma Scale, the GCS as we call it. We take eye, verbal and motor responses in that GCS scale, and for you to understand on a basic ground level fact is that we grade the consciousness level on the basis of the GCS score from 3 to 15, where we rate 3 to 8 as a mild, as a severe grade of head injury, 9 to 13 as a moderate grade of head injury, and 14 to 15 as a mild grade of injury. Now, GCS is important because we prognosticate the improvement, the future outcome on the basis of this GCS Coma Scale. So it becomes pertinent to understand on the part of the attenders, on the part of the patients, to understand that when the doctor says that your GCS at presentation is 8 and we need to intubate the patient, we need to ventilate the patient, you have to understand that the GCS of 8 is considered a very severe traumatic brain injury, and the outcome will depend, and the economics of the treatment will be higher, and the monetary part of the treatment will be higher, and it will be a prolonged treatment. That's what you have to understand as a patient and as a socially aware public of this great country called India. So the GCS is important for a public to understand that the patient having a low GCS will have a protracted long stay in the hospital. He might need an ICU stay. A GCS of 9 to 13 is a moderate grade of severe injury. He might need an ICU and ventilator for a few days. Then we'll transfer the patient to the wards, and then after 7 to 10 days we can transfer the patient to the home with anticonvulsant and anti-epileptic medications. Here we have to understand that a patient with a GCS of less than 8 or less than 8 will have to undergo some certain procedures depending on the requirement and the findings on the CT scan, and may have to remain on the ICU, inside the ICU and on the ventilators, and he may need to be tracheostomized for a long period of time. So these are the things which are very intricate in nature, and this requires the study of all these books that I have shown you. But for public to create a basic awareness on this fact, the public should know that when the GCS is low, they have to have faith on the science of neurosurgery, the expertise of the neurosurgeons, and they have to be aware of the fact that this brain has been created by God, and we can help brain and support the brain to get better with time. The brain after injury behaves like a child's brain, so we have to wait for the brain to respond, come back to normal, and this will take time. So my whole intention of creating awareness around this topic of traumatic brain injury is that patients in the public and the patients should be aware that head injury is a very serious kind of an injury, and this requires patience on the part of the patients as well. And once you are aware of the kind of treatment that you are going to face, the kind of the long duration of treatment that you are going to face, then it becomes easy to accept the challenge that lies ahead, and it also becomes easy on the part of the patients to understand and what to expect after traumatic brain injury. So One aspect was that. The second aspect is that whenever a patient comes to the trauma, the emergency department, we have to understand that the GCS assessment gives us the prognostication of the patient. However, GCS, the global, the Glasgow Coma scale, can be clouded or can show a different picture if the patient is having already earlier history of traumatic brain injury, earlier history of clouding of consciousness, earlier history of paralysis, and a history of having drunk alcohol and then driving and suffering trauma. So patient of drunken driving, suffering a brain trauma, then comes to the emergency department, then the assessment of GCS becomes difficult. So it's all the more important for you as the public, as the members of the public, to understand that avoid drunken driving, because one aspect is that if God forbid you suffer some kind of head injury and you land up in our emergency department, it becomes all the very difficult for the doctors to understand your GCS. And when the GCS is not understood within the few hours of your admission, it will become all the more very difficult for us to manage you. Therefore, it becomes incumbent upon you to avoid drinking and then driving. So drunken driving, I would like you to ask to avoid, not because of only you, but because of the economic burden you could pose to the society if you, God forbid, you suffer a certain road traffic accident after under the influence of alcohol. So this is for you. This is a takedown message for you from neurosurgical texts, that the GCS is becoming clouded, and GCS is not correct when you have such predisposer factors. Now, several other scales the Yeoman's textbook of neurosurgery proposes to grade the injury. One such is the Marshall's grading, which grades the brain injury on the basis of diffuse injury from grade 1 to 4, increasing on the basis of intracranial pressure, which rises. So because when there is a head injury, there is a bleeding inside the brain, and all those bleeding can lead to an intracranial mass lesion inside the brain, and all those mass lesions will lead to an edema inside the brain. Since this skull is a fixed bony structure, and the brain edema will lead to expansion of the brain and the compression of the structures inside the brain. All these things will lead to a very catastrophic sequence of events leading to deterioration in the patient's consciousness, the falling of the GCS, and this is graded on the basis of Marshall's grading system, which is of more consequence and consideration for the neurosurgeons. And something that the textbook speaks about, the fact that the traumatic brain injuries have been seen to be more on the dependent on psychosocial factors also, like the factors like female gender, and the patients who have suffered a physical assault, intentional physical assault, and prior history of traumatic brain injury, lower socio-economic and educational status of the patients, and these are all the predictors of poorer prognostication or poorer outcomes. And therefore, we can understand on the basis of the study that this work promulgates that those patients who are having head injury or coming with head injury, psychosocial factors also play an important role. So, on the basis of this understanding, we should promote education. That's the basic reason behind why I came for discussion with you all on the traumatic brain injuries, because the psychosocial factors have a great bearing despite high levels of medical care, high levels of expertise in the neurosurgeons nowadays, high levels of ICU care. Still, the patient outcome depends a lot on the psychosocial factors, the educational factors, the socio-economic well-being of the patient. So you should create your awareness regarding such traumatic brain injuries, so that the outcome becomes better. Now, the prevalence of the traumatic brain injuries. It has been said that across the world, the global burden of disease study identified a worldwide incidence of 365 per 1 lakh population. So it has been said that according to the humans, and when they compiled the data across the world, they found that per 1 lakh population, suppose in a district town of my state Bihar, it has a population of 15 to 17 lakhs. So per 1 lakh population there will be 365 traumatic brain injuries a year. So in 10 lakhs population will be 3650 patients of a traumatic brain injury, random traumatic brain injuries from all the causes. In a population of suppose 15 lakhs in a district in a state of Bihar, we can have almost 5500 cases of traumatic brain injuries. So it becomes a very difficult task for a neurosurgeon in the future, or the contemporary neurosurgeons, to manage so many cases. Suppose a district has a single neurosurgeon, it's very difficult for him to manage almost 15 to 20 cases per day of the traumatic brain injuries or the head trauma. So these data actually helps us to understand that we should be aware of the problem of the traumatic brain injury in our society, and we should take steps to avoid it. For example, when an elderly who is having some vertigo or some hypotensive episodes or a history of fall, we should be very peculiar that they should not go into the bathroom at night, and God forbid they should not fall. We should not have terrace without a boundary so that our children should not fall. We should not leave our small 2 to 3 year old children alone so that they will fall from the stairs. We should not go out as a pedestrian and walk across the road without seeing the zebra crossing. We should not be driving bikes without a helmet. We should not leave our fellow passengers on the back of the seat without a seat belt. All these things will come into picture only if we are aware of the problem that lies beneath that the silent epidemic of traumatic brain injuries. Only if you are aware, only then you can understand and prevent those things from happening. So that's my whole idea of initiating this talk with all of you. I feel you'll find it interesting by the intuitive design of this topic that I tried to discuss with you all. So now coming to the next topic, that the population at risk, the humans, and when very clearly states that across the world it has been seen that the burden of traumatic brain injuries has been increasing in the age group of less than 4 years of children and more than 65 years of elderly. The precise reason that they are giving that in the West there are improved traffic regulations, improved policing on the roads. Therefore, the road traffic accidents, their incidence is coming down. Therefore, and since we are having a greater life expectancy, so in the elderly due to fall, in the children due to fall, the incidence of traumatic brain injury is slowly rising. Therefore, on this basis, we have to come to a conclusion that we should be more aware and we should be more careful about our children. That world over it has been seen that the children and elderly are more prone to fall, more susceptible to head injuries. So we should be more careful and more aware about our children and elderly, because they have a greater incidence as we progress. So this is the take-home point of this. Now, Human further states that the traffic safety laws have improved, and therefore the younger patients are having less incidence of traumatic brain injuries. Humans also states that with the longevity, with the increase in cardiac risks and all, the patients are taking aspirin, clopidogrel, all the blood thinners and anticoagulants. This leads to thinning of the blood and bleeding in the brain with every small fall in the elderly. So again, this also makes us to understand that those patients who are taking aspirin, those patients who are on anticoagulants, you please take care of those patients. They should not fall, they should not go out on the bikes without helmets. So you understand, I'm making you aware of the kind of relatives you have, those kinds of patients who are cardiac disease patients, heart disease patients, who have a propensity to fall and then lead to bleeding in the brain and brain trauma. You should be extra aware that they should not go out and land up in some accidents, and they should always go out protected. So this is the take home from this part of the humans. Now the humans again talks about the mortality rates. It says that there is almost 11 mortality per 1 lakh population. In China, a study was done in 2013 and 14, and they found that there is a 12 to 13 mortality rate in a population of say 1 lakh. So we understand that in a population of 1 lakh there will be 13 mortality per year. So in a population of 10 lakhs there will be 100 mortality or 130 mortality in India. So a population of 10 lakhs will have almost 100 to 130 deaths per year from traumatic brain injuries, despite all kinds of interventions and whatever we can do. So this is for the society to understand, and that the kind of difficult situation we are facing in the form of traumatic brain injuries. So it again becomes important on the part to understand the seriousness of this condition and to make attempts to avert and to stop this from happening, rather than waiting for this to happen and then going in front of the doctors and the neurosurgeons to say that, sir, how can we save our patients? We can support you with neurosurgical knowledge, with neurosurgical expertise. We can help you undergo procedures which will find out a better way of taking them out of the situation that they are in. But it's upon you to take steps to prevent it on the first at the first step. Now, the humans further goes on to let us know that various studies have demonstrated a decline in the incidence of traumatic brain injuries across the Western world. They have attributed this factor to the better understanding and awareness among the public regarding better implementation of the Uniform Code for Traffic Rules, and then police reinforcement, road safety backed by legislations, and strict limit on blood alcohol composition while driving, and then the use of seat belts, separate seat belts for child at the back, and firmly enforced speed limits on driving, and better communication systems, better transit systems for transferring the patients from the road to the neurosurgical facilities. All these things will improve over time in India also, like it has improved in the world as we progress over the next decade. We understand this mechanism of head injury and the sequelae and all those things which are going on. Now, regarding the take-home points from this chapter is that the epidemiology has helped us to understand head injury as a topic, basically from the perspective of a neurosurgeon as I speak to you. And it has helped you understand also how to prevent neurosurgical brain trauma, how to avoid trauma to your brain, and even if it happens, what steps to take, and how to improve an outcome of your patients. I think this has been a fantastic Sunday morning, and it was nice talking to you. I'll go back to my work now, because we have continuous duties, and work timings are 24/7 throughout day and night, and we just get time in between to meet our family members for a few hours, and then we are again back to work. So that's how the life of a neurosurgeon is. Thank you so much for hearing. Thank you.